I'd like to acknowledge the local custodians of the land in which we meet on this evening and honour elders past, present and emerging. I'm Melissa Wilkinson from the Hunter New England Central Coast Primary Health Network. I sit in the education team on the beautiful Central Coast. Welcome everybody. We're here tonight. We've got some great numbers and it's a great topic, so we're really excited about presenting tonight for you. Just some housekeeping. There will be a poll as standard at the end of the session. I strongly encourage you to please complete that. It only takes a couple of minutes and that's how we plan for further events and get our data on your input, so that you utilise that opportunity to be able to have your say there. We are recorded and available in a few days. A copy of this will be in our education library via the website. I know if you've already inquired about that, so yes, that will be happening, and a copy of the presentations will also be available in the website. The questions box, I strongly encourage you to make this as interactive as possible, so pop any questions you have. This is your opportunity and chance to do that, to ask those questions from your presenters that you would like to. So without further ado now, I'm going to hand over to Dr. Nata Borges and hand over to you to introduce the speakers for tonight. Thank you.
Thanks, Melissa, and thanks everyone for joining us tonight. I'm really excited about today's speakers. So today's session is all about exercise and how we can support our local communities by getting them to engage with new innovative community-based programs that we've been looking to develop. So I was the program lead for the Master of Exercise Physiology at the University of Newcastle, which started in 2021. And part of our program ethos was to really be externally facing and to interact and engage with local business partners to produce and provide community-based exercise programs where we also developed essentially authentic work integrated learning opportunities for our students. So it was really a multi-pronged initiative where we tried to benefit the community, the students, and also the university. So again, really happy with our presenters today. So we have two exercise physiologists, both of which have been involved with some of our innovative programs that we've been looking to develop. One is Mr. Sam Johansson and the other is Mr. Matthew Kolosinski. And yeah, I'm going to pass over to them so they can let you know the things that have been happening and how we've been supporting our local communities. So Sam, I'll pass over to you. And yeah, we'll get started.
Great, thanks Nata. So just a little bit about myself. My name's Sam Johansson and I'm a senior exercise physiologist here at Hunter Rehabilitation and Health. I've been an EP for around 4 years now. As an EP, I see multiple different conditions, but I do specialise in musculoskeletal conditions. So today we're going to chat a little bit about the Engage program, which I facilitated through the University of Newcastle. So we'll move on to the next slide. So I just wanted to talk a little bit about my why. So why I became an exercise physiologist. Now, at the core of that, I wanted to educate and empower all humans to move more and live better. And at Hunter Rehab, we also uphold these values, and we're always looking for ways to help out in the community. And that's why it was such a good opportunity when the Engage program was announced. We were really eager to jump on board so that we could really help out the community and have a big impact in a large way. Move on to the next slide. So a question I get asked a lot is, what is an exercise physiologist? So I thought I would just quickly touch on that. So as an AEP, we're health professionals and we excuse me. So we are professionals in designing and delivering exercise programs for acute, subacute and chronic medical health conditions. So the one thing that a lot of people don't know about EPs is that we do deal a lot with acute and subacute, not just chronic medical health conditions. So I'll jump to the next slide. So the types of clients that we see are Medicare, DVA, private, work cover, CTP, life insurance, NDIS and My Aged Care. So I thought I would just throw that in there for everyone and we can come back to that a little bit later on if people have questions about that. But I'll move on to the next slide. So today's focus, to start with, I'm going to chat to you a little bit about successful aging, and then we're going to move on to more of a breakdown of what we did with the Engage program. And following on from that, I'm going to evaluate the effectiveness of the program and what impact it had on the community. Okay, so successful aging. So successful aging is defined as the process of developing and maintaining functional ability that enables well-being in older adults. So with Australia's growing and ageing population, the need for successful aging has never been more important. Successful aging is comprised of 4 factors, which I've got for you there: physical, social, cognitive, and psychological. So I'll move on to the next slide. Okay, so the benefits of successful aging. There's a large number of benefits to successful aging. Adults who age well are more likely to be satisfied with their lives, feel happier and healthier, and live longer. They're also more able to participate and contribute to their community as well. So how can we assist with successful aging? Well, Engage is a great place to start. So Engage is a 12-week program that looks to provide senior Australians with an avenue for fun and socially engaged exercises. So the core, in addition to this, the core purpose of the program was to combat the social, psychological and physical burden of aging. The program was also developed to create learning opportunities for students. So a big part of Engage was addressing social isolation. So studies have found that older people who experience extreme loneliness are up to 26% more likely to die prematurely. And this has become even more prevalent over the last couple of years with the pandemic. So with technology and telehealth services, it is possible to address this issue and help older adults connect with the community and create a sense of belonging. So the benefits of exercise. The exercise component was another big aspect of the Engage program. 75% of older Australians aren't getting enough physical activity, and this can increase their risk of chronic disease. So exercise has been shown to play a huge role in the prevention and management of chronic disease. It has also been shown to have a number of positive impacts on these conditions. And Engage was designed to harness all of these benefits and implement it in a fun and enjoyable way. So what is involved in the Engage program? So the Engage program comes at no cost to the participants. It was a 12-week intervention and it was facilitated by accredited exercise physiologists as well as exercise physiology students. Now the inclusion criteria for the program was you had to be over 65 years of age, have access to the internet and a device with Zoom capabilities, and have no contraindications to exercise. Move on to the next slide. So far, Engage has recruited 37 older adults. Of these 37 adults, each had extremely varied levels of physical activity. We had some people in the program who were completing 0 minutes of activity per week, and we had some that were completing 375 minutes per week. So quite a big range there. So how that was when we were creating the Zoom breakout rooms, the individual groups, we had a group that was completing a low amount of physical activity. We had 2 groups that were moderately active and then 1 group that was very active. So that way we could tailor the exercise to each group depending on where they were up to, so that each group got the most out of the program that they could. As well as this, most of the participants in the program also had comorbidities, and we screened them prior to the program to ensure it was safe to exercise. So to further sort of go into a little bit more depth about the program, the participants completed 2 hours a week for the duration of the 12 weeks. And the activities were completed in both large and small groups. There was a number of different activities and some of which were participant-led as well. So just to break that down for you a little bit more, I've got that table on the side there. So what we would do is we would come into the Zoom call as one big group and then have some introductions. And then what we would do is we would separate into small groups. Now, the first activity, once the small groups were established, was a sharing activity. Now, keep in mind that so in these small groups, there was about 4 to 6 participants per student. So it was quite small and they were getting quite a lot of engagement and attention with the student that was in their group. And then I would also be in the group at points to make sure that everything was running as it should be. So with the sharing activities, these were designed to help the group, the participants in the group, get to know each other and find some commonalities, and yeah, really foster a bit of a community within those groups. So some of the examples of what activities were done were, there was things like sharing recipes, doing some show and tell. Some participants would find something in their house that meant a lot to them or had a particular story behind it, and they would share that with the group. And that would bring everyone a lot closer together, and they would discuss different commonalities and things like that. Then the biggest part of the program was the exercise component. So how the exercise component was run was the participants would start with a warm-up just to get them moving. Some groups even incorporated a little bit of dancing into their warm-ups, which was fun, and the participants really enjoyed that. Then they moved on to some range of motion exercises. So that included quite a bit of stretching, just to make sure that they were ready to go for the strengthening exercises, which were next. So with the strengthening exercises, that involved whole body strengthening, so upper and lower body, and this was regressed and progressed depending on how the participants were going. So that high activity group, they were doing quite difficult exercises, while the group that hadn't had much physical activity before were doing quite regressed exercises. But across the program, we saw everyone progressing through their exercises as the program went on. Now, the creative aspect of the session, this varied quite a bit week to week. Some of the activities that the groups were doing were things like virtual tours, virtually walking around museums and art galleries and things like that. And this created a lot of conversation and brought up a lot from the participants about where they'd been in the world and things like that. And it was a really good activity. Another group did some drawings, which they completed over a couple of weeks, and then they would share that drawing with the group, and it was a location that meant something or had a story behind it that they could share with the group. And then each week we rounded out the session with an educational activity. So this was delivered by myself or one of the students. Some of the topics that we covered were nutrition, falls prevention, successful aging, topics like that too. And these were often suggested by some of the participants as well, that of topics that they wanted to learn a little bit more about. Let's go to the next slide. Okay, so what impact did the program have? So far, 2 rotations of Engage have been completed. The program recruited 37 older adults in the region, of which 33 participants continued with the program. The dropouts here were due to scheduling and unrelated medical issues. Now, of those participants who finished the program, the average attendance was 85%. So to me, that was one of the best outcomes from the Engage program. As EPs, we really pride ourselves on being behaviour change experts. And as you can see, we really had a large impact on this community. We fostered an environment that the participants wanted to turn up each week, and they really wanted to socialise and get to know everyone, as well as do the exercise component. And the beauty of the Engage program is we were able to reach so many people at once and really bring that community together through Zoom and telehealth. Move on to the next slide. So the participants were also required to do a post-program feedback survey. So as you can see, the preliminary feedback data indicates that the program was well received, and those surveys that I mentioned on the last slide that were done throughout the program were also showed that we had a positive impact. Now, the majority of the participants reported that the program was enjoyable and provided them with an avenue for social interaction. Move on to the next slide. Now, I thought what I would do is pop together a little bit of a case study. Now, this case study is quite indicative of a lot of the participants that were in the program, but Kate in particular. So Kate was a 72-year-old female, overweight, arthritis, and she was also recovering from COVID-19. Now, Kate, when I did the pre-screening with Kate, she mentioned that she was currently doing 0 exercise and physical activity throughout the week. She also mentioned that she was fatiguing quite easily, and she had a lot of trouble with her balance. Now, Kate commenced the Engage program once per week, and she was doing the 2-hour session, and she was also doing the exercises at home. So the students gave each participant a printout of the exercises that they were doing in the class, and then they were doing that in between our sessions as well. Now, by the end of the 12 weeks, Kate had reported decreased fatigue. She was mentioning that she was more able to do her activities of daily living. I think more specifically, she was saying that it was much easier for her to clean the shower screen. She could squat up and down a lot easier to do the shower screen, and that was due to her increased strength. So Kate managed to increase her sit to stand score from 11 repetitions to 24 repetitions, which is quite a significant improvement. She also mentioned that she was feeling more steady on her feet, so she had increased her balance, and she was also really enjoying the social interaction that was a part of the program. So I'll move on to the next slide. Now, this here is an email that I received from Kate towards the end of the program, and in this email, as you'll notice, she is saying how much the program means to her and how much it has benefited her over the 12 weeks. It really helped her to step outside her comfort zone and start exercising, as well as pushing her to go out and socialise with some of her friends that she hadn't seen for quite a while. And as you can see at the end of the email, she even said that she's feeling much more energised in herself as well. So this story here is one of many from the Engage program, and for a lot of people, including Kate, the program became more about socialising, and the exercise was a bonus. So a lot of the participants were turning up each week just because they were wanted to tell everyone how their week was, or they wanted to tell everyone what they'd been up to on the weekend. It was really, really good to see. So the social aspect was really quite great throughout the Engage program. So the student evaluation. So the students also showed great improvement across the program. They showed improvements in self-efficacy and also work readiness. And these, as you can see, these both improved significantly. The Engage program was great for the students. It was a really good opportunity for them to get hands-on and practice delivering exercises via telehealth. And personally, I saw over the 12 weeks a really big growth in the students, and that was in terms of confidence and their knowledge as well. So they went from being, a little bit timid with communicating with the participants to really sort of taking charge and getting some really good results exercise-wise, like we just saw with Kate, across the 12-week program. So what's next for Engage? Well, with the positive impact that the program has already had in the telehealth space, the Engage team and Hunt Rehab are looking to run another 2 rotations in the next 6 months. Now, I've just popped down the eligibility criteria as well. So across July, we're actually trying to recruit more participants for the rotations. So if you have any patients in mind that are eligible, feel free to email the Engage email just there. Or alternatively, if you're after more one-on-one EP sessions, more than happy for you to contact Hunter Rehab and we can help out. We're based in Newcastle, but we can travel and we do provide telehealth sessions as well. So that brings me to the end of my presentation. Now I'm going to pass it over to Matt, but we will come back at the end for any questions that anyone has about all of that. Thank you very much.
Wonderful. Thank you so much for that, Sam. I'll pop my one up and we'll get ourselves going. Beautiful.
Yeah, looks good.
So, wonderful. So thank you once again to the Primary Health Network for letting me to come along and share my experience with the student-led exercise physiology clinic. My name is Matthew. I've been an exercise physiologist for about 11 years now. I was very fortunate with my very early phases of being an EP, whereas I moved straight into the cardiopulmonary rehabilitation unit with the Hunter New England Local Health District. And I was also involved in the Stepping On Falls Prevention Program and the Otago Home-Based Falls Program. So I've been very fortunate to have been incorporated in the chronic disease and aged care stream of the public health system for about 11 years now. It's been a great opportunity where I've learned a lot. I've been able to put myself up into a senior position within the Hunter New England Local Health District, and it was a great opportunity for me to get so much vast experience in the world of chronic disease and aged care, interacting with falls prevention clients, interacting with cardiac clients, respiratory programs, and then a whole bunch of other comorbidities within the systems that we had in place there. And then a great part I've been able to do now is to be involved with the University of Newcastle as an associate lecturer and as the practicum coordinator for the Master of Exercise Physiology program. So that's a role that I've been very grateful to have been in now for about 7 or 8 weeks now. And one of the great jobs that I get to do also is to be the one that facilitates and runs the student-led exercise physiology clinic at the Sports Science building at the Uni of Newcastle Arimba campus. It's a bit of a mouthful. So what I'm going to try to do for today is just talk a little bit about the whole idea of exercise and why that's an important thing, to look at the role of an exercise physiologist and how we can help with incorporating physical activity and exercise programs to a wider range of clients. And then the most important part is looking at how we can then share our grateful experiences we've had with the next up and coming budding EPs that want to come into the world and learn more about what we get to do, but then also emerge themselves into their own clinical practice and develop their own clinical skills and ideally be able to treat and prevent chronic disease to a wider range of clients. So Sam alluded to a lot of really good things already about the importance of exercise and physical activity. And I think from my point of view, I just wanted to further reiterate the really important part that we look at within that is the profession of exercise physiology is a great opportunity and a great discipline where we're very lucky that we get to look so much into the whole pathology behind a chronic condition that can affect an individual or individuals, but then also we get extensive training and experience in looking at then how we can incorporate systems and strategies to an individual and for an individual to ideally to help treat and prevent those chronic diseases, or at least help them manage their lifestyle with modifications so we can ideally enhance the quality of life for that individual in the best way we can. I personally love our job. I think we get to do a great thing. We get a great opportunity. We get to see so many amazing clients. We get to learn so many things from all of our clients. And I've been very fortunate in my role to work from anybody from the ages of 30 to 103. And then within that, every single client's got a story, as every single client has a need. And I think what we all would have learned very quickly over the past 2 years especially is that sometimes clients just need to be listened to. They just need ears. They need someone just to be able to talk to them and find more about their story. And as we'd all agree, the better we can connect one-on-one with that client, the greater chance we have at implementing an effective strategy so they can start to manage their own health and wellness in a much more effective way. So that's the great thing that we get to do. We are university trained allied health professionals. We go through very, very in-depth level look at goal setting, behavior change, behavior modifications, looking at exercise progressions, regressions, restructuring training programs for clients to make it incorporated, and also helping clients to understand that exercise can take a broad range of different types as well. So physical activity, the looking at body movements that we incorporate throughout our day-to-day. I think for a lot of individuals, we sometimes might take our health literacy level for granted, where we understand a lot of the time that physical movement in the day is a thing that we all engage in, we all do. But then at the same time, the big thing we consider in a lot of our current day and age is day-to-day physical functions and activities are gradually being made easier and less strenuous on the body. So the burden we need to consider for a lot of our clients is, while this is a nice, easier way to manage people's day-to-day, the fact that we're missing out on getting their bodies moving is taking a bit more of a concern for a lot of us globally. And we're starting to realize that we need to set time aside for our clients to actually move their body and plan some time in the day to understand the importance of regular physical movement. And the big thing that's came apparent from that is, through the World Health Organization, they've stated that 1 in 4 adults and 3 in 4 adolescents aged 11 to 17 do not currently meet the global recommendations for physical activity set by the World Health Organization. And that's from the World Health Organization Global Action Plan on Physical Activity 2018 to 2030. So it's been highlighted quite quickly that there's a big responsibility on a lot of us for our clients, and it's not necessarily just clients. Chances are, for a lot of us on this webinar right now, we know a fair few people that might be needing to get themselves moving a bit more. And that's the part we need to consider, is then we realize there's a job that needs to be done. So then the great responsibility we all have is not just finding a solution to the problem, but finding a way that we can implement that solution to the client so they believe in themselves, so they can self-manage their own physical health and wellness, and they can continue to progress themselves. And as Sam said, through the Engage program, it's a great opportunity to teach and educate our clients that may have a low health literacy level of looking at what they can actually do for themselves to minimize the risk of further complications from eventuating. As we all know, the ideal part about it is to prevent chronic disease, but in some parts, treatment-wise, there's still a lot of positive effects we can place on exercise and physical activity for a client, so that they believe that they can break it down and get it done during their week. So this is the great opportunity that presents itself with the student-led exercise physiology clinic. So one of the biggest goals we have within the clinic is to provide a platform where students are then able to learn and develop their skills as growing and up-and-coming exercise physiologists. So then they can have a look at being able to deliver high-quality exercise programs under the guidance of evidence-based treatment from an accredited exercise physiologist, but the students are the ones that get to be in charge of driving the client assessment, the client prescription, and then ideally the client delivery. And I've included there on the screen that lovely little dinosaur you've got. If you do have any phones available, I'm pretty sure you can scan that QR code and it should take you to the website for the student-led exercise physiology clinic. And within that, there's a lot more information that's on the website about all the different chronic conditions that we cater for within an exercise program, because I'm sure a lot of us understand quite quickly, incorporating exercise into a client may mean that the medical history might take a variety of different formats of different conditions we need to be mindful of. We are quite highly trained in being able to accommodate for a multitude of comorbidities with a client, and then setting aside with the client and then their other medical professionals, what are the most important things that we need to work on in the treatment plan from the beginning. So those kinds of discussions we definitely encourage between the students to hear from the accredited exercise physiologist, who would then liaise with the medical professionals and the GPs and the other health professionals in a handover on what the client's being referred for and how we can help out the best we can. So we do encourage that very clear communication process with the student of, even once we do an assessment with the client, there's a nice situation I run with the students where once the student's done the assessment and they've got all the information they need, they've done their outcome measures, we start to look at how they can interpret all the data they've just got. And then we write it all up on a whiteboard. We do a bit of a case conference between the student and the accredited exercise physiologist. And then we start to consider what are the main things the client identified are their goals, what are their likes, their dislikes, what's their previous exercise history or lack thereof, and then also start to consider what kind of a treatment plan are we going to look at, what kind of exercises would be beneficial for the client, what other factors do we need to consider with regards to the client's limitations and hindrances they may have, and then also making sure that the client is on board with actually wanting to go in the direction we want to take them. So a lot of the times we say that it's accredited exercise physiologist driven, but student led at the same time. So there's always the assistance where the AEP and the student will have that collaborative approach to the final say in the client's program, and then making sure we've got good rapport with the client. So a lot of those interpersonal skills are really important things we encourage the students to develop along the way. And there's a lot of regular chances for feedback on helping the students to develop those kinds of skills as they go through. So the big part we also consider with regards to some GP referrals is that it will be accredited EP led, but then the student can observe in some situations like that. The supervision will always be there between the EP and the student. And we really love this opportunity for students to have that integration because they've spent a lot of time in front of lectures and labs and tutorials and doing case studies and scenarios. But now it's a great chance to let them, as they get towards their Master of Exercise Physiology program, to move themselves towards more of an effective application of all that amazing theory they've got. And we've had really good feedback from the clients at the moment that are really more than happy to allow the students to drive the session. And if they make mistakes along the way, there's a really good understanding for the clients because they're really appreciating being part of the student's growth and development into the clinician that they want to be. The big part we consider also from a cost-effective treatment method is that an initial consultation is $20 and a student-led session costs $10. So there is a great opportunity within that where in our little pocket that we have down in Arimba and the greater reach we have to those socioeconomic areas and the demographics around there, is we are working a lot more on engaging and integrating between different community areas to see if we can get more people that want to come in and be part of a student-led session, but then also allow people to understand that the cost of an actual high-quality training session between an accredited exercise physiologist and an EP student and the client is actually quite an effective measure that they can incorporate. We run a booking system that allows us to book the clients in, and then we can send SMS reminders to them if we need to let them know when their sessions are coming up. The other part within that gives us a great chance is within the program that we utilize, it gives us a really good chance and opportunity to allow the students to practice their clinical documentation as well. So we hold a very high standard to the level of a SOAP note that we encourage the students to do, where they get some nice broad understanding of the subjective data. Then they can start to interpret more of what observations they found along the way. And then within the assessment criteria is where they can start to mention more about what they've actually been able to do with the client. And then a really big thing we focus on also is what's the plan moving forwards? What is the client going to be looking forward to achieve? What are the students going to incorporate into the routine for the clients along the way as well? So the benefits to the GP, it is a cost-effective exercise intervention that they can have their clients coming into the clinic. It gives a really good opportunity for client groups to then have that student clinical placement experience. So we do appreciate the patience that clients have within that, but then at the same time, it does give clinical experience in the client journey where the clients can ideally start to see the initial inception of the client into a program or from a referral. They can do the assessment part of it. They can then look at the longer term training and exercise plan. And then they can also look more along the way where in some parts, if we're not discharging the client per se, we can still run scenarios where we get the client to actually write up a discharge report or a client report. So then we can proofread over it and then we can send that back to the GP if they request that as well. Or we can still get them to write it up. We can attach that document to the client file as part of a clinical record, even if it's not something that the GP requires or it needs to be sent off. So we still allows us to run through the full scenario from client referral to assessment to the whole exercise program design and then the implementation of the delivery. And then it allows consecutive sessions to go through along the way to watch the client's progress and then also to do final outcome measures at completion of the program and then have a look at a bit of a report for the GP. Benefits to the client. The clients appreciate the student learning experience. They do get a lot of enjoyment from the cost-effective exercise treatment, and the supervision of the accredited exercise physiologist does allow for that integration where if the client has some more technical questions they wish to ask that the student can't answer, there is an AEP that's on board that's able to ideally give more clear-cut answers for the client, but then also help the student to develop the understanding. And then the benefits to the student, it's a brilliant clinical experience The students do get to experience quite a wide range of different client groups. So they do get a chance to see client groups that may have more of a cardiovascular domain, a pulmonary domain, metabolic conditions, any other organ conditions, bone, musculoskeletal rehab as well. And then within that, as we know, there's a lot of clients that may tick a few boxes along the way. So it does also help us to teach the client about their clinical reasoning and looking at the relevance and the purpose of the program session so they can make it more beneficial for the client. Current services we've also got on the board is there is a diabetes and exercise research group that one of our researchers and lecturers, Dr. Emily Cox, is running that I actually help facilitate, and that's a telehealth and face-to-face based diabetes and exercise based program. There is also in a very short amount of time, there's going to be commencement of the Lungs in Action program, which is it's umbrellaed under the Lung Foundation Australia. However, the Lungs in Action program is a program that is encompassing and incorporating for a wide range of different chronic conditions that a GP may seem necessary. It's a whole lot of fun. The clients enjoy it. It is group-based exercise. There are initial assessments prior to the group commencement to find the best fit of exercises. And then the other services are also just general members of the community. And that's been the great part we've also had is some really good engagement from a whole bunch of staff members, people that live around the local area. We've been very fortunate to have had some really nice word of mouth referrals from current clients wanting to get their friends on board to come and train as well. A client testimonial that I only just acquired this information from Friday from one of our clients was one of our clients, would call her Kylie, that had been a member of the student-led clinic since May of 2021. Did have a noted past defect in her L5 and bilateral shoulder hypermobility and residual pain and tightness in the upper trapezius. So she already had a fair few musculoskeletal concerns we had to accommodate for. She is a wonderful client that brings a lot of joy to the students. The students really love her when she comes in, but then at the same time, I must commend her a lot, even though she won't hear this, is she actually brings a very positive atmosphere to the students of wanting them to learn and grow. And in some situations, we'll actually get the student and almost allow them to explain it differently to her so the student can learn a different approach to how they might coach and cue and exercise along the way. So I've had some really good positive impacts to clients already over the past year of the program running. Over through the pandemic, the guys that were running the program did a great job to revamp things and get it all generating fresh again. And I must definitely acknowledge the work that Natai and my offsiter, Christy, have done through the EP clinic along the way to get everything up and running, to get things going, to get referrals, to get the website going. They've put a whole lot of hard work behind it, and we're really starting to see the fruits of their labor along the way. So in summary, it's a great learning experience for the student that are on clinical placement. It's a great community engagement from the local area of clients that support the student learning experience. The teaching environment does allow us as the lead clinicians to then be able to give the clients a bit more coaching and a bit of a debrief at the end of the session. So there's a great opportunity within that where we can actually sit the student down and look at what worked well, what do we need to work on. It gives us a great chance to provide real-time feedback along the way. Please, if anybody does have any inquiries, the email handle at the bottom there is all one word, xphysclinic@newcastle.edu.au. At the same time, there's a screenshot at the top of the Exercise Physiology Clinic website that we have there. That little screenshot or photo that we have there is actually of our group fitness-based aerobics area. And then there's also another gym component we've got on the other side of the room as well, where they've got more of the free weights, more of the machines, more of the cardio equipment. And there's a few other bits of specific equipment we've got in there that can accommodate for disability and wheelchairs and amputees. So we do also incorporate quite a wide variety of exercise types and strategies for all different clients along the way. So we do aim to be very all-inclusive, and we've been having a great time having the students on board, and we're looking forward to having a lot more referrals along the way. And please, if you have any inquiries, feel free to let me know via that email, and I'll be happy to answer any questions along the way later on tonight. Thank you.
Great, thank you so much. If anyone has any questions, can you please pop those into the questions box now? So far, we haven't received any, which is a good sign. It means you've covered everything. But I'll just get the panel to pop your cameras back on.
Yep.
And if anyone has any questions, please pop those into the box now. Is there any regular questions that you normally receive about the program or that's commonly asked of you?
I guess the biggest question that I get is how do you go getting everyone to turn up each week? That's probably the biggest one, which I talked a little bit about there. And the biggest thing was just creating that really good social environment. That was probably the thing that really drove the program and kept people coming back. And I think that's why the sharing activities and the creative activities were so valuable. That was really drawing people to the program because they were getting to know one another, meeting new friends, and really creating that sense of community, and then getting the exercise benefits as well. So that's probably something that I get asked quite a bit, and that's typically my answer because it's so hard to get people to get on an exercise program and stick with it. So I think that's what was really good about the program.
Yeah, that's great. Sorry, Mel, and I'll just tack on to that because I think what Sam mentioned was perfect in terms of us really looking to develop a community around the program, and that's what I think really drove that really high attendance. I think another concern or issue that or question that we had initially when we were developing the program was how are you going to keep attendance in a telehealth setting? Given the population are over 65 and they may have technical difficulties and they may not have the equipment or the Wi-Fi. And to be honest, I think the online portal actually went really well, and the participants actually really loved, I guess, learning, how to use Zoom, and within the educational series that Sam was talking about, we would use the share screen function, or we would teach them how to search for things online, or how to use certain platforms, and how to use YouTube to maybe look for how to find a recipe. So I think part of the program, outside of just the physical and social benefit, was also increasing maybe a little bit of the digital literacy skills, and that was also an underlying aim that we could maybe really promote the benefits of online communication and online socializing for a population that may not be used to doing that or accustomed to doing that. So I think that was another benefit from the program that I saw too.
That's great. There is a question that's come through from Christine. Are older people concerned about the length of each day or managing to participate for the full day?
Yeah, that's definitely another question that we get quite a bit. From just being on the program, I didn't have anyone at all that complained about the length of the program. It actually went quite quick. We sort of found towards the end, we sort of go, we're almost running out of time. And I think that was just due to changing it up quite a bit with all of the different activities, not just doing a 2-hour exercise program. So because we had all of those other activities and we were sort of in the small groups and then all back together and sort of changing it around quite a bit, that helped with engagement and keeping people there and coming back each week. And I also think as well, we had a lot of the participants driving sort of what we were doing with those activities. So some participants were suggesting what we would do for the sharing or the creative activities, and then if we were getting a lot of feedback saying, we'd like to see a educational presentation on falls prevention, then that's what we would have the next week. So really sort of pivoting and changing the program to accommodate what the participants were looking for was really keeping them coming back and not really worrying about the 2 hours. And yeah, I think too, because of the demographic that we're engaging with, they didn't have, they had no issues with blocking out that 2 hours on that particular day.
Yeah, that's great, especially getting their input, gives that ownership and engagement. That's great. So is there any other comments? And if anyone has any questions, please pop them in the questions box before we sign out tonight. So yeah, is there any other comments or common things that you found, common themes running through?
I guess just over the whole program, it was a little bit hard. We didn't take objective measures to start. A couple of groups took objective measures, but we didn't actually have objective measures that were implemented across the board. But that's why I thought it was important to highlight that case studies. We did get some really good results with all of the participants, and they all reported that they got a lot of benefit out of it. But I think moving forward, we're going to look to implement some more set objective measures so that we can yeah, really put some numbers on those improvements, rather than just saying, yep, they improved, and getting them saying they improved. We can really get those numbers to say that they did really well.
Okay, great. There's no more questions coming through, but if anyone does think of any after we finish tonight, you can always email them through to me at education@thephn.com.au, and we can forward those to the presenters for you as well. So any final comments before we leave? We're going to give everyone an early mark tonight, which is nice. So any other final comments? Or
I might just jump in there, Melissa, and I'll just say that you know, I'm really happy and proud about, like, you know, the impact that I think this program and the university is having on the region. I think we all can appreciate that, you know, everyone understands the benefits of exercise, and we all know that we should be doing these things, and it's going to improve our physical, social, cognitive well-being. But I think the real next step is really trying to figure out how we facilitate population level improvements or increases in physical activity and engaging with exercise. And I think that's really what we're trying to do here with some of these community-based programs, is provide an opportunity to really engage with our local community and support them in starting that journey, and providing them a little bit of the, you know, education in terms of the tools that they can take away and apply maybe when they're not in a facilitated or supervised session. And really hope to, you know, improve the physical well-being of the local community, because everyone knows exercise is good, but for whatever reason, a lot of people aren't doing it. So we're just trying to figure out the best ways to support some of those communities to be as active as possible. So I'm really happy with the progress, and I think Matt's been doing a great job and Sam's been doing a great job. So we're really happy as a team, I think, about the progress we've been making. So feel free to engage with us, no pun intended, I guess,
Hey.
through all the kind of email accounts. And if anyone has any questions, then we're happy to share those at a later date too.
great.
Hey, now we've got a question. Yeah. Now it's Tren.
Yes.
I do have a question. Where are the majority of referrals are coming from? If Sam knows.
Yep. So that's why maybe a little bit better at answering that question than myself. But we did have a lot of referrals come from around the Central Coast area. But then we also did do a little bit of a recruitment drive with Hunter Rehab social media. So that sort of went out to sort of the Newcastle and broader area. But then a lot of them did come from down around the Central Coast, which were, I'm not sure, Nato, what was the main method for recruiting there? Yeah,
so for both rotations that we've done, I would say the main or the key method has been social media engagement through Facebook mainly. We did engage through a number of different community groups, but we found that social media advertisement was the most effective method. But we're also, you know, happy to take referrals from anyone on the call. Like we have quite open eligibility criteria. So if you know anyone, or if you have a patient or anyone in mind, a family member, a friend, who you think may be suitable for the program, just like we mentioned, email through a request to that engage@newcastle.edu.au email, and we'd be happy to look to see if we can get them in on our next 2 rotations that we're looking to do.
Thanks, Nathan. Thanks, Sam.
I've got another question that's just come through. Any examples of objective measures that you might use?
Yep, so in that case study that I had, a simple sit to stand test is probably the most common one, which one group did implement, and that was the group that case study was from. And so I pulled that data, and that was, as you can see, from 11 to 24 repetitions is fantastic. But simple things like doing also a push-up test against the wall, because it's quite low impact, quite safe to do at home. You can also do things like a balance test as well. So there's different variations of those that are more appropriate for certain people, but things as simple as standing on one foot or standing with one foot in front of the other are some of the common ones. So those are probably 3 very simple ones that we could look to implement. But then there's a vast majority of other ones, but I think along those lines would be the safest for us to implement, because we're not there in person. And I think that was probably the main reason for not implementing it to begin with as well, which is sort of the safety aspect. But I'd really like to see that somehow incorporated into the program in the safest way possible.
Okay, great. A lot of positive comments coming through. Well done, thank you. Lots of positive stuff coming in. Just a reminder to everyone that the poll will be at the end of the session. I strongly encourage you to please complete that. There will be a recording in the Education Library as well as with the presentations in the coming days. So a couple of minutes, just in case anyone wants to add a last little question in there. Trin, have you got anything else that you'd like to ask?
Thanks, Mel. I don't have any more questions.
Okay. I think we've covered it all. It's always a good sign. Okay, well, I'd like to thank everyone for being here with us tonight. Thank you to the presenters and thank you to all on this wild and windy and rainy night out here on the coast, I can tell you that. So yeah, thank you everybody, and looking forward to catching up with you. Have a lovely evening and we'll talk to you all soon. Thank you.
Thanks everybody. Thank you. Bye-bye.
Bye.